Operations Director at the South African Depression and Anxiety Group, Cassey Chambers, joins us now for more reaction. Cassey, good to have you, and thank you very much for your time. We are hearing now from the outcomes of this inquest that the political principal and the head of department at mental health can be held liable, at least for the deaths of some of the patients. How do you receive the news? The NPA saying they are, of course, looking closely at this judgment.
I think for us as a civil society organization, we've been working on this for 8 years. We started off from having meetings and engagements and litigation and ombuds reports and arbitration. So for us, this is 8 years worth of fighting and pushing and really trying to make sure that a judgment or some more accountability comes to light. And I think today we got that. We feel hugely vindicated after all this work. And to have now in writing that these two are responsible for those deaths, I think is a huge achievement. And it takes a real village. So many different people from, as you heard earlier, from the family members and the Life Esidimeni Family Committee and SASOP and Section 27 to get to this point 8 years later is a huge relief. But at the same time, it's also very bittersweet. You can hear the pain and the grief and the raw suffering that so many of these family members have had to endure every single day for the last 8 years. Yeah. And while I think it's really important that we have got some more answers and some more clear direction from today's judgment, I think it's also bittersweet because it also still reminds us that we lost 144 people and that their deaths could have been prevented if the two that were named responsible today had just acted differently or listened to those warnings. And I think that's always a real hard pill to swallow because they should have not died. Yeah. And I think that's what we're stuck with. So it's both a bittersweet, a huge relief, really a roller coaster of emotions.
Yeah. Are government departments, as you put it, acting differently now that we know that we should have listened to experts and this would have been avoided? But as far, for example, as improvement in institutional capacity, are government departments doing better?
I think that's a really good question because I think we have to have a hard look at what the state of mental health in South Africa is, never mind even just in Gauteng. When we're looking at the fact that we haven't seen an increase in the number of beds, the number of professionals, increased access, improved community mental health services, so much more needs to be done. We're not okay with just the quality of services that patients and family members are getting on the ground. So more definitely needs to be done. And I think now is a pivotal moment and the Life Esidimeni judgment has come at a crucial time in the country when we've got new ministers and executive and provincial governments that are coming in place, is we really have to take a hard look at what happened to Life Esidimeni. How did we get there? Why we didn't listen to all these different organizations? And what the ultimate cost of not investing and looking after mental health. We have the fatalities of 144 loved ones that died and hundreds more that survived and were moved back during that marathon project. Yeah. So for us, I think more needs to be done. The state of mental health has a lot of room for improvement. And I think when we're looking at things like where do we even begin to improve the mental health system in South Africa, the first place is improving budget. Yeah. We need to be investing more money. Yeah. This year, the national health budget was reduced, and the first areas that we're looking to reduce that would be mental health. Yeah. As it is, less than 5% of the health budget is allocated to mental health. It's not enough for the state of what we're needing to improve. So we have to learn more and we have to do better. Yeah. Life Esidimeni shows us what happens if we don't prioritize mental health. And I think for the patients who are accessing care today or tomorrow or next week, we have to do better to improve the quality of care. And I think also improving the human rights of patients living with mental illness across the country.
Is that allocation, that 5%, is it ring-fenced? Because one of the recommendations of the recovery plan of Life Esidimeni was do better. I mean, look at whether or not that amount can be ring-fenced. Two, reallocate, you've mentioned community mental health budgets with specifics looking at specialists and as well as specialized hospitals.
Mm. Well, that's, I think, where we're having to really understand what the budgets are being used for and that open transparency. I think what we do know is that the majority of that 5% budget is allocated to in-hospital care, so specialized hospital care. There isn't enough invested in community mental health, and that's where we know the majority of people are needing that support and out of hospital care. So I think a lot more needs to be done in re-looking at the budget. We have seen some improvements over the last few years with the new mental health strategy and policy framework that has come out. And that's a good document. And I think in South Africa, we've always had really good documents, a good mental health care act. We're just now having to make sure that these documents are implemented on the ground and that we can see the difference happening in our communities across the country. When we still see on a daily basis calls that we're receiving to Sadag of patients who are being turned away from clinics because the medication has run out, or they're waiting days to get a hospital bed, or they're turned away because there's no space. Those are the kinds of things that we should be doing to improve our mental health care access. Never mind all the other communities where there are no psychologists or psychiatrists or psychiatric medications at clinics. These are the kinds of changes we need to be seeing, and drastically and very quickly, because I think, again, this is the pivotal moment where we're saying mental health does matter, but now we really need to see those plans in place.
Yeah. Between the Treasury, between the Department of Health, they want to make this about infrastructure management. They're saying, look, we needed to, of course, make resources available, but therefore needed to move these patients to particular facilities, which has raised a question around the standard operating procedure on reviewing all our mental health facilities and units as to whether they are up to standard. Are we seeing an improvement? Are we doing better there?
I think this is definitely a place of room for improvement. You know, we fully agree and support the fact of having to make sure that the facilities where we're sending patients in different communities have all the resources, that they have the infrastructure and the support services in place to properly look after patients with these kinds of needs, so that we don't ever have to deal with the Life Esidimeni issue again. We haven't seen a huge improvement in the number of these NGOs. We don't have enough for the need that is on the ground. It's very easy to say, let's reduce the high cost of inpatient hospital care, but we also have to make sure that we have NGOs and communities where we can send patients to go and become part of the communities. And I don't think we've seen that uptake enough or strong enough that we should be. I think when we're also looking at what those kind of infrastructures look like, is we're having to make sure that those little checks and balances are in place and that they're realistic. These plans can happen if there's a proper plan in place with proper consultation over an adequate time period. When we try to hastily rush this or cut costs where we are, we cannot, and we cannot continue to allow mental health to be the cost saver for the department. We're having to make sure that they're investing just as much money, if not more, because we know that the dire state of mental health in the country. So for us, we're needing to say, don't use mental health as the scapegoat. We're needing to make sure we put these proper precautions in, because these patients deserve it. And we can hear that the vulnerable group of patients have really been impacted. And I think the concern for us is going forward is we need to see more change. We need to make sure that this never happens again, and that no family, no loved one, no person living with a mental health issue should ever have to deal with this. And I think when we're talking around resources as well, we've seen some of the issues that have happened in Gauteng, where so many NGOs, due to funding, have had to close, organizations that have been part of the bedrock of our community. So I think that there's some serious looks that we have to check into and review how we're doing things and how this money is being ring-fenced, to make sure that we don't wait till there's a crisis or an emergency, or in the Life Esidimeni tragedy, that there are lives lost. Let's avoid and prevent those from happening if we start consultation early.
Cassey Chambers, appreciate your time, Operations Director at Sadag there.